before we go, I actually want to bring up my executive director. Peter Goldberger has been with the funds since 2007, and I hope I got that right. 2009, I was close. He has been with the unions for pretty much his entire career. And I will say it is just an honor to work with this man because he is really been a driving force behind so much of the work that we've done here and the support and confidence that you have given the Health Fund to continue to do this work. So with that, Peter Goldberger.
Well, thank you very much, Cora and Lee. It is my honor to close out this conference today. I'd like to first be able to thank some of the folks who made this possible. I want to thank the people at City and State. I want to thank McCabe Partners. I want to thank the staff of the Metropolitan Pavilion. I want to thank the Health Fund staff who, in their day job, are out there fighting relentlessly for 32BJ members and their families, making sure they get excellent care, fight against high prices. And I want to thank the folks from our strategy and policy team. I'm going to call out 3 people, and it's really not fair because there's even more people, but 3 people who led and made this happen, which is Misha Sharp, Keenan Lane, and Claire Brockbank, who you all saw today, who were amazing. So I want to end the conference with a very brief story and a challenge. So 5 years, almost to the day, I sat in my backyard. It was actually a cold, damp October 2020. I sat with the Secretary-Treasurer of 32BJ, Larry Engelstein, and we were discussing a problem. 1, it was in the height of COVID, so we were sitting outside. 2, the union members had been through a really rough time, and so had the employers. Members, some had been laid off, some had worked crazy hours, employers all didn't have the money, and the union knew it had to negotiate big contracts coming up for these folks to help them recover from the COVID era. And healthcare, as you've heard today, the cost of healthcare stood in the way of what those members needed. And our problem was that the biggest driver of healthcare, high hospital prices, nobody talked about. People talked about drug prices, they talked about administration, they talked about lawsuits. Nobody talked about it. So there began a process of trying to create a strategy and then implementing a strategy to put this issue on the map, to hire a policy strategy team to gather far and wide all that's being done to try to tackle this issue, bring those people together, create a labor management fund to let the public know about these issues, to lobby on particular legislation that could change the rules of the game. And then finally, as we saw here today, a series of healthcare conferences, this being the largest we've ever had. And if you look in the room, the people here are elected officials, they are providers, they are payers, they're policy experts. But there's one group really not represented, certainly not up front. And I want to note that on the day of this conference, which I said was our largest ever, there is an op-ed from the head of Greater New York, basically denouncing our work in his name, Ken Rasky, in the form of the Fair Pricing Act, which is just a way, as we've heard earlier today from the sponsors, to save New York consumers millions of dollars in healthcare costs. And here is my challenge to Mr. Rasky. Join us. Don't fight us, join us. And I say, a year from now, we will have an even bigger conference, and I believe, sincerely, that there'll be somebody in one of those cushy chairs who will represent the hospital industry, and they will say, we get it. We cannot solve our problems on the backs of the commercial payers. We cannot have an unsustainable increase in costs, so people have to be poor to get health care. And we're going to partner with the people in this room to make that happen. I know we can do that. I feel like what we've created here and what we continue to create is a momentum that goes from New York to New Jersey. What we're seeing in Indiana and California will only grow. So I want to thank everybody who was here today. I want to thank you for your participation, and I want to thank you for your future participation. So thank you.